Here we must say what is bundle branch, what is Purkinje fibers. We are all familiar with all those things. If not, you should learn it by heart. So here we already know that from the SA node, the electrical impulses are carried forward to the AV node, then to the bundle of his to the right and left bundle branch to the and Purkinje fibers. So in this case, the left bundle branch is being blocked here. Just see the left bundle branch is being blocked here. Just observe here. Okay. So what will happen? The current from the bundle of his first enter the right bundle branch and to the right ventricle. So the current will flow clearly. What will happen? It clearly flow to the left ventricle due to left bundle branch block. Sorry, there is no current flow to the left ventricle due to left bundle branch block. There is a P wave due to the contraction of atria. We all know this P wave is due to the contraction of the atrium. That is the P wave here. That will occur because the atrium is contracting. There is no problem with the atrium. Okay, so there is a QRS complex due to the depolarization of right ventricle. Usually the depolarization occurs simultaneously, but here the left bundle branch is blocked, so the right ventricle will depolarize first. Then after slowly the electrical impulses from the right ventricle will move to the left ventricle. Okay, so it form another QRS complex. That is a one QRS complex of right ventricle, another QRS complex of left ventricle, like an M pattern or rabbit ear pattern. This is seen in V6 lead. Why it is seen in V6 leads? Because it is the left ventricle is being depolarized only after the right ventricle, and the lateral leads are located near to the left ventricle. Here you should see the right bundle branch block. We discussed earlier that the M pattern or the RSR dash pattern is seen in the V1 leads. Okay, it was seen in the V1 leads, but here this pattern is seen in the lateral V6 leads in left bundle branch block. See the QRS morphology. See the V1 deep RS pattern is seen. Deep RS pattern. You see the S wave here. The S wave is slurred S wave. We can clearly see the slurred S wave. The RS pattern is deep and slurred S wave in the V1, and in right bundle branch block it was seen on the V6. Here it is V1. Don't forget, it is a left bundle branch block. See the slurred RS long wave, wide wave in V1. Okay. In lateral reads we can see RS R dash pattern or the M pattern as we have seen in V1 in case of right bundle branch block. Okay. RS R dash pattern. Then why there is a Q wave is why the Q wave is absent. Here we can very much clearly notice that the Q waves are not present here. Why the Q waves are not present? Due to you know why the Q waves are occurring? Due to the septal depolarization. Septal depolarization. Since the left side of the ventricle is blocked, the right side is sending the signal to the left side. That is why there is no Q wave. Okay, since the right to left transformation or the channeling of the current occurs, there will be a left axis deviation. You must check the lead 1 and the lead AVF for that. Okay, you can see the left axis deviation. See in this ECG you can clearly well definedly identify that. You must see in this ECG that in the V1 lead you can see the wide S wave. The wide S wave you can see here clearly. You can see the wide S wave. Okay, wide S wave in the V1, and it is like a slurred and wide S wave RS pattern in V1, and there is no Q wave here. You cannot appreciate any Q wave here. No Q wave here. And in V6 there is that RS dash pattern V5 V6 lateral lead. So the diagnosis comes as it is clearly well defined as left bundle branch block. Okay, you should see the ECG very clearly. It's a left bundle branch block with what should you would appreciate. You could see that the next. This is also another case we're discussing. In this case, what you should understand the rate of this ECG as you could see that it is a 1, 2, 3 large boxes, so it's probably 90 beats per minute with a regular rhythm. With a regular rhythm, since the P wave is followed by QRS complex, regular rhythm. They are regular rhythm. Okay, so we check the lead V1 and the lead V6. Okay, in the lead V1 we could see that there is no Q wave, and this S wave, the S wave was slightly wide and long, slurred S wave, and you could see the V6 lead you could clearly see that notching of a V6 leads. So it's a left axis deviation, left bundle branch block. Okay, it's a left bundle branch block. And also you see that the axis, in the axis you see the first lead one is positive and the lead AVF is negative. So it's clearly it is a left axis deviation. Okay, left axis deviation. Next, the case 3, you see that the you check the rate of this ECG as just check the rate of the ECG rate. It is two big squares and three small squares. So it is 150 by uh, 13. 150 by 13. This is the answer here. Why? What should you do? No, it is 1500 by 13. It is 115 beats per minute. Okay, this is a bit tachycardia. But when you are looking about the rhythm, all the P waves are followed by QRS, so it is a regular rhythm. Okay, a regular rhythm we have seen here, and we see that the lead one and lead AVF are flowing away. Lead one is positive, and while lead one is positive and lead AVF is negative. So it's a left axis deviation. Okay, left axis deviation we can see here. Next, we see that the V1 is clearly seeing a wide S wave and RS pattern, which is wide and long. In V6, there is a notching of the QRS branch more complex. So it's purely a left bundle branch block. At beats per minute is 115 and it's sinus rhythm. Okay, that's the final case. Thank you for listening. Have a nice day.